Welcome, and thank you for joining us today. This presentation is titled, Building Capacity to Provide Culturally Safe Care, an approach to reducing harm and removing barriers for Indigenous women and gender-diverse people who use cannabis. As a note, throughout this presentation, the phrase Indigenous women and gender-diverse people will be utilized, and we'd like to clarify that this also encompasses people who are two-spirit, transgender, and of other gender diversities. Throughout this one-hour training, we'll explore how to strengthen understandings and approaches to cannabis care in a way that respects Indigenous perspectives, addresses trauma, and reduces stigma. This training aims to equip you with the tools and insights to provide more compassionate, inclusive, and effective care. This presentation will be comprised of 6 sections. These include a background context, understanding Indigenous perspectives on cannabis, trauma-informed care in primary care settings, cannabis as harm reduction, there'll be a case study, and we'll present Indigenous cannabis initiatives and resources. Let's begin by exploring the background of this project. We'll provide an overview of the Native Women's Association of Canada's Cannabis Project and outline the learning goals for today's session. To guide our discussion, we'll also highlight key Indigenous learning lenses that will help us frame our approach. As a disclaimer, the information presented today takes a pan-Indigenous approach to understanding cannabis. While the content has been developed from diverse community voices across the country, it's important to recognize that the information throughout is not representative of the opinions and feelings of all Indigenous individuals or communities. Funded by Health Canada's Substance Use and Addictions Program, the Native Women's Association of Canada, or NWAC for short, has conducted ongoing engagement and research to identify and improve the critical gaps in culturally safe and stigma-free cannabis education. This project takes a new approach to a long-standing dilemma. As more and more Indigenous women and gender-diverse people choose to use cannabis in its many forms, there still exists a lack of information available to health and social service providers, whether they're new to practice or have been practicing for years. This emerged as a priority topic during our community engagement sessions and has highlighted the need for more Indigenous-led education that reduces the stigmatizing and oppressive norms. Cannabis use may serve a variety of purposes, from recreational use to harm reduction as a safer alternative to other substances. It can be used as medicine for a range of conditions and for many other valid reasons. This project aims to provide health and social service providers with the foundational language and knowledge needed to enhance culturally safe care for Indigenous women and gender-diverse people who use cannabis. To accomplish this, NWAC has developed tailored webinars for 3 distinct groups, each with unique roles and learning needs. Today's webinar focuses on primary care providers. While the learning objectives remain consistent across all 3 webinars, the approach and examples of each are tailored to align with the different professions' needs and responsibilities. To ensure this project reflected the voices and needs of Indigenous women and gender-diverse people, a 7-member advisory circle was established. The circle brought together Inuit, Métis, and First Nations partners and included an elder, knowledge keepers, and representatives from primary care, allied health, and social service fields. The advisory circle collaborated across 8 content development meetings. Through sharing both their lived and professional experiences, their insights have provided the culturally safe and trauma-informed knowledge that will be presented throughout today's session. Their dedicated work has ensured that this project remains meaningful, relevant, and responsive to the needs of Indigenous women and gender-diverse people who use cannabis. Prior to developing the webinars, NWAC surveyed 45 health and social service providers to better understand the current gaps in training and knowledge related to cannabis use and culturally safe care. From the results, 4 key learning goals emerged. They are understanding the difference between problematic and medicinal cannabis use. So by examining the distinctions between these patterns, providers can better support patients and recognize when cannabis use serves a therapeutic role versus when it might be a source of harm. Address stigma and personal views. Stigma around cannabis use remains a significant barrier, both in patient-provider interactions and within healthcare systems. Through learning more about Indigenous perspectives and discussing cannabis use, we'll aim to reduce stigma and create more supportive environments. discuss therapeutic approaches. We'll do this by discussing harm reduction, trauma-informed care, holistic health principles, and understanding cannabis use in a way that respects Indigenous perspectives and experiences. And lastly, we'll present resources and ongoing education materials. Since knowledge and practices are continually evolving, we'll highlight a variety of tools and resources that can support your ongoing learning and enable you to provide more informed and compassionate care. As we move through the presentation, you're encouraged to activate your two eyes and consider how both your trained perspectives and Indigenous knowledge can be used together to better support patient health and well-being. Two-eyed seeing is a concept that Mi'kmaq elder Albert Marshall introduced to encourage people to view the world through two perspectives. One eye focuses on Indigenous ways of knowing, while the other eye on Western scientific knowledge. By combining the strengths of both eyes, we can foster a respectful balance and create more holistic solutions. For example, this could look like working to integrate culturally significant foods into someone's diet while also considering Western nutritional guidelines, or collaborating with a traditional knowledge keeper to incorporate ceremony or medicine into someone's mental health treatment plan. It's ultimately about recognizing the importance of fostering balance between culture and clinical approaches. By incorporating Indigenous practices into care plans, you can help build bridges between Western and Indigenous methods and ensure that health solutions honor your patient's cultural values. That leads directly into supporting holistic health. I'm sure you've heard of the World Health Organization's definition of health. That's a state of complete physical, mental, and social well-being, and not merely the absence of disease. This aligns really similarly with Indigenous perspectives of holistic health. Indigenous knowledge emphasizes the interconnectedness of all aspects of health, which can be visually represented through a circle of balance. While the medicine wheel is a well-known framework for this concept, it's important to acknowledge that it's not universal to all Indigenous groups. However, the idea of striving for balance is a shared principle across many communities. This concept of balanced health encompasses physical, mental, emotional, and spiritual dimensions, with each being equally as important in achieving well-being. When one's out of balance, the others are impacted. For example, physical health is often the center of Western health approaches and treatments, but it's equally as critical to nurture our mental well-being, as it's fundamentally interwoven in with our physical state. Further, our relationships and our feelings, or emotional health, deeply influence our mental state. And spiritual health gives many people a sense of purpose and connection to traditions, providing grounding and resilience. Together, these dimensions create a complete version of health that emphasizes balance, rather than focusing on one aspect alone in isolation. As we move forward, whenever the word health is broadly mentioned, please keep this definition in mind. With this foundation in place, let's begin exploring how to deepen our understanding of Indigenous perspectives on cannabis use. Cannabis has been utilized by Indigenous people for thousands of years, long before colonization. Evidence from archaeological findings, academic studies, and oral histories, as well as early journal entries from European explorers, confirms that Indigenous nations across Turtle Island have used cannabis and hemp in various forms. From textiles like clothing, mats, nets, and fishing lines, to serving as items for trade or economic exchange, and medicinal use. There was definitely a symbiotic connection between people and plant, rooted in practicality and sustainability. However, this relationship with cannabis was profoundly disrupted by colonization. Unfortunately, there's still a significant knowledge gap in understanding the pre-colonial relationships that Indigenous groups had with cannabis. Prohibition laws and stigmatization severed many Indigenous people's access to traditional practices. The criminalization of cannabis use disproportionately targeted Indigenous communities, echoing the already prevalent policing and marginalization that was seen with alcohol use. These systemic injustices not only eroded cultural connections and oral histories, but also reinforced harmful stereotypes about cannabis use. All of this has led to historical research biases that have failed to fully capture the reality of Indigenous relationships with cannabis. But despite this history, Indigenous communities are reclaiming and revitalizing these practices. Combining both traditional knowledge and modern innovation, practices surrounding cannabis use are restoring the cultural connection. Beyond practical applications, such as using hemp for tools or textiles, various forms of cannabis consumption also promote balance and healing by addressing physical ailments, calming the mind, and fostering emotional and spiritual reflection. Cannabis can also represent a connection to land, sustainability, and environmental stewardship. These examples highlight some of the multifaceted and deeply rooted relationships Indigenous people may have with cannabis. Understanding historical and current contexts of cannabis is essential for appreciating the broader significance of cannabis and honoring Indigenous relationships to the plant. It also underscores the importance of supporting Indigenous-led approaches to cannabis use through a lens of cultural safety. Something important to consider is the intention behind cannabis use. Intention is critical to the outcomes of health and wellness. The way we approach plant medicines, our mindset, purpose, and respect determines the relationship we cultivate with them. When cannabis is utilized with mindfulness, it can help align the individual better to its purpose. Without intention, there's a risk of becoming disconnected from the traditional values and teachings associated with it. As a health provider, it's important to approach conversations with respect and recognition of how relationships with cannabis use are diverse and shaped by unique historical, cultural, and social contexts. Avoid making assumptions about why someone uses cannabis or the potential impacts it may have on their health and well-being. Instead, create a safe and open place for discussions that respect the individual's experiences and choices around cannabis use. It's also important to recognize the complex and intersecting ways Indigenous people continue to face significant barriers when accessing both healthcare services and medical cannabis. These are deeply rooted in historic and ongoing systemic issues, including anti-Indigenous racism, stigmatization, and biases, which complicate and restrict receiving the care they need. Current interactions and experiences with the healthcare system are shaped by long histories of mistreatment, many of which continue to influence the quality of healthcare Indigenous women and gender-diverse people receive. While we don't have time to review all these, we highly encourage accessing additional education resources to learn more. Another barrier is logistical and geographic access. For example, many individuals in northern, rural, or remote communities often travel long distances to other parts of the country just to receive basic health services. This not only poses financial and cultural challenges, but also highlights broader issues of healthcare access and inequality experienced by these communities. So how does this relate to medical cannabis? When Indigenous women and gender-diverse patients wish to incorporate cannabis into their treatment plans, they often face many challenges. As NWAC has identified, there's a general lack of accurate information about cannabis and its medical and cultural uses from Indigenous perspectives. This, in combination with a shortage of healthcare providers who are knowledgeable about or willing to integrate cannabis into care plans, challenges access options. Cannabis is also not covered by the non-insured health benefits program, so patients who rely on this are often forced to pay out of pocket, limiting access through financial barriers. Accessing cannabis could also activate past traumatic experiences, such as fears around racism, child service involvement, or other discriminatory consequences. These barriers highlight how health providers must be informed and sensitive to the unique challenges their Indigenous patients may be facing when accessing both health services and medical cannabis. Understanding these systemic issues can help in effectively addressing culturally appropriate solutions. Building on that, we'll further discuss addressing stigma and discrimination as it pertains to cannabis use. The stigma surrounding cannabis use is deeply rooted in colonial systems of control. Extending beyond criminalizing a plant, these laws represent broader racist policies aimed at policing Indigenous bodies and cultural connections to plant medicine. Prohibition reinforced harmful stereotypes, and that legacy continues to shape how Indigenous people perceive and access cannabis, especially within the context of health and social care systems. When working with Indigenous women and gender-diverse people, it's essential to consider how intersectional experiences, such as gender identity, sexual orientation, socioeconomic status, disability, and culture, can compound stigmatization and create additional barriers. Care provision must be approached from culturally safe and trauma-informed lenses to ensure equitable and compassionate support for a person's complex health and social needs. Another essential approach is using non-stigmatizing language. Words and language are powerful for creating connections and fostering trust and respect in relationships. Avoiding language that perpetuates stereotypes or demonstrates judgment can help create more open spaces for supportive dialogue surrounding cannabis use and its role in well-being. Finally, it's important to acknowledge the diversity of viewpoints Indigenous communities and individuals hold around cannabis. While many embrace cannabis and connect it to cultural practices and traditions, many also outright reject it and oppose it due to legacies of colonial trauma and influences driving stereotypes. This polarization can result in people who use cannabis being excluded from community ceremonies or events. So it's important to approach cannabis conversations sensitively. Perspectives and experiences will differ across individuals, communities, regions, and generations. It's also critical to consider how lived experiences shape interactions within healthcare settings. Let's explore how a trauma-informed framework can help us better understand and address the impacts of trauma. Trauma itself is a response to distressing events, whether that's a single incident or prolonged exposure to adversity. It affects holistic health and well-being and fundamentally shapes how people perceive and interact with the world around them. A trauma-informed approach to care recognizes how common trauma is and how it affects all aspects of people's lives, including their interactions with healthcare providers. The goal is to create a safe space where patients feel supported and in control. For Indigenous women and gender-diverse people, this means understanding how historical and ongoing acts of colonization continue to shape their lived experiences. It's also critical to understand that trauma-informed care doesn't mean asking patients to relive or reflect on their trauma. Instead, it shifts the focus to their strengths, the resilience that they've developed in surviving trauma, and how that resilience can become a foundation for healing. When this approach is not utilized, there's a risk of causing re-traumatization, which can leave patients feeling unsupported or even blamed. This could discourage them from seeking services again, further exacerbating barriers to care. This process of becoming trauma-informed requires you to first recognize how significant the impacts of colonization are on the lives of Indigenous women and gender-diverse people. Historic and ongoing processes, such as the residential school system, the 60s and millennial scoop, the foster care system, forced and coerced sterilization, gender-based discrimination within the Indian Act, high rates of incarceration, the theft of land and resources, among many other factors, have all had deep intergenerational effects. Acknowledging that these things impact your patient is critical for helping you to create culturally safe environments and offer compassionate care. All of us carry a set of values, formed by a variety of influences over our life course. These values, whether conscious or subconscious, inform how we engage with others. It's also important to recognize how our work is influenced by our own perspectives, and to question how structural racism, discrimination, and biases have been built into health and social service systems. We must consider how these systems specifically affect Indigenous women and gender-diverse people's ability to access services in a respectful and dignified way. Through these reflections, we can begin to apply two-eyed seeing. This allows us to recognize and respect the ways that traditional knowledge and biomedicine can coexist. Integrating these approaches simultaneously provides an opportunity for patients to make more culturally relevant, balanced decisions regarding their health. Some further tips for providing trauma-informed care are: that it's important to remember you don't need to know the specific trauma a person has experienced to provide trauma-informed care. What matters is creating a safe, supportive environment where patients feel respected and heard. Be mindful of your positionality and privilege. This means recognizing how your own identity, background, and experiences influence your interactions with patients. For instance, avoid medical jargon and use plain language to ensure shared understanding. Let people know that you want to work with them and don't simply tell them what to do. Another key aspect is practicing empathetic listening. It's about listening with intention, without interrupting or rushing to solve the problem, and without imposing your own beliefs or assumptions. Ask patients how you can make their visit or appointment more comfortable. And finally, helping patients to make decisions that best support their holistic health and well-being is central to trauma-informed care. Providing patients with the information and options that they need to make choices that feel right for them while respecting their autonomy helps foster resilience and healing. Next, we'll be discussing how to recognize and respond to trauma activation. As a note, we'll be using the term activate instead of trigger when referring to something that awakens a memory, feeling, or symptom related to trauma. The reason for this change is that the word trigger can carry violent connotations, which can intensify the emotional response. Our advisory circle elder explained that trauma is energy that's physically locked within the body. Using the term activate is a gentler way to describe the experience without causing further harm. Trauma activation can occur in response to various stressors, including environmental, sensory, or interpersonal cues. These might include specific sounds, smells, places, sensations, confrontations, or even particular words or phrases. Activations are deeply personal and unpredictable, so it's essential to remain attuned and sensitive during interactions. There are several signs to look out for when someone's experiencing a trauma activation. Physical signs may include increased heart rate, sweating, shaking, or appearing physically frozen. Emotional responses can range from fear, anger, and sadness to shame or numbness. Behavioral signs include avoidance, hypervigilance, unexpected outbursts, or freezing. On a cognitive level, individuals may be experiencing flashbacks, intrusive thoughts, confusion, or distorted thinking. Recognizing these signs allows us to provide appropriate and sensitive support. When responding to a trauma activation, the first step is to validate the person's experience. Acknowledge their feelings without judgment and let them know that their emotions are valid. Create a safe and calm environment where they feel secure. Offering grounding or coping techniques such as deep breathing or sensory focus exercises can help, but it's essential to let the person guide the process and choose what feels right for them. Be patient and avoid pushing them to share more than they're ready for. Above all, it's important to ensure that they feel in control of the situation. Experiences of trauma often leave people to feel powerless. As a care provider, it's important to ensure that they have options and control over what happens next. This could look like asking if they want to stop the consultation, if they want to continue, take a break for a few minutes, among other things. By understanding common stressors, recognizing the signs of activation, and responding with empathy and care, you can create a supportive space that fosters trust and helps individuals feel safe. Finally, having a trusting relationship is an essential foundation for providing trauma-informed care. This can be fostered by creating safe physical and emotional environments where patients feel respected and free from judgment. In a physical space, this could look like rooms being soundproof and more private, ensuring accessible design features like ramps, wide doorways, and clear signage, or even incorporating calming colors throughout. Emotional safety can be achieved by using inclusive language, being mindful of pronouns, and ensuring that staff are trained in understanding diverse identities, including those of two-spirit, transgender, and gender-diverse people. Setting clear and consistent boundaries can foster trust and predictability in a patient-provider relationship. This includes being clear about expectations, maintaining consistency in how you engage, and allowing space for people to ask questions or express concerns as they arise. Share power with patients by involving them in the decision-making and respect their autonomy. This means engaging in ongoing conversations about their care options and preferences, providing them with the tools they need to make informed decisions, and encouraging them to express their needs and concerns openly. Prioritize cultural safety by honoring patients' diverse experiences and traditions. Be open to learning about cultural practices and tailor care to be culturally appropriate. It's important to approach conversations with humility and curiosity, continuously learning and evolving to create an environment where patients feel valued and understood. And finally, remain flexible with treatment options. This may involve discussing different treatments, acknowledging potential barriers to access, and offering choices that feel right for the individual. Most importantly, all treatment decisions should be made with ongoing informed consent, ensuring that patients feel comfortable at every stage of their care. Now let's focus on how to apply all the important pieces we discussed when navigating cannabis use with Indigenous women and gender-diverse patients. In this section, we'll explore more about cannabis use, harm reduction, and help guide supportive conversations. Harm reduction is an evidence-based, patient-centered approach that focuses on reducing the health and social harms associated with actions that have a risk. It emphasizes meeting people where they're at and supporting them in ways that align with their individual goals and circumstances. Unlike traditional approaches to substance use that often demand abstinence, harm reduction provides a more inclusive and flexible alternative. By using non-judgmental and non-coercive strategies, harm reduction minimizes risk while offering opportunities to connect people with resources, peer support, and services, ultimately reducing substance-related health and social challenges. When it comes to Indigenous patients, there are additional considerations to take into account. As we've discussed, systemic racism in healthcare continues to act as a barrier, preventing many Indigenous women and gender-diverse people from accessing culturally safe supports for cannabis use. Additionally, resources and services are often concentrated in urban centers, leaving rural and remote communities underserved. It's vital to envision how supportive care could be adapted to these settings to ensure equitable access. Through a harm reduction approach, we can help build supportive environments where patients have the power to pursue health and wellness in a way that's authentic to them. Now let's dive deeper into understanding cannabis, beginning with foundational concepts. Cannabinoids are the active chemical in cannabis plants that interact with our body and brain when consumed. There are over 100 different cannabinoids, and they work by interacting with a system in our body called the endocannabinoid system, or ECS. Interestingly, our bodies naturally produce similar chemicals, known as endocannabinoids, which play an essential role in regulating stress, mental health, immunity, and overall wellness. Cannabinoids from cannabis mimic these natural chemicals, fitting into the ECS in much the same way and influencing how our bodies respond. The two most well-known cannabinoids are tetrahydrocannabinol, or THC, and cannabidiol, or CBD. THC is responsible for the psychoactive effects of cannabis, commonly referred to as the high. It works by fitting into the ECS like a key in a lock, temporarily replacing the body's own endocannabinoids. On the other hand, CBD typically does not produce a high. Instead, it interacts with the ECS to enhance the effects of our natural endocannabinoids. CBD may even reduce some of THC's psychoactive effects if it's present in equal or greater amounts. While CBD is often thought of as the medicinal cannabinoid, it's important to note that THC also has therapeutic potentials. In medical cannabis use, people often use a combination of cannabinoids, as both THC and CBD offer unique benefits depending on the condition being treated. When it comes to choosing cannabis products, it's helpful to categorize them into three main types based on their THC and CBD content. THC-dominant products are high in THC and have minimal CBD, resulting in stronger euphoric effects, or high. However, these products also carry a greater risk of undesirable effects like paranoia or discomfort, especially at higher doses. CBD-dominant products, on the other hand, are high in CBD and low in THC, offering little to no high, and generally a milder, more relaxing experience. Lastly, balanced products have a mix of THC and CBD in ratios like 1:1, 1:2, or 1:3. These are more likely to create a relaxing, body-focused effect with less of the stimulating high associated with THC. Beyond the product type, the method of consumption is also a key factor. Cannabis can be consumed in various ways, including smoking, vaping, ingestion, sublingual drops, topical applications, juicing, nasal sprays, suppositories, and transdermal patches. Each method has unique effects, durations, and purposes, which is why finding the right combination of product and consumption method can be a trial and error process. It's essential to consider individual needs and goals to identify the most suitable option. Now that we understand cannabis better, let's explore how cannabis can be utilized for medicinal purposes. Most cannabis research is still in the early stages due to regulatory processes. It takes years to gain approvals, secure funding, and pass preclinical trials before clinical trials involving humans can take place. However, it's becoming increasingly recognized for its potential to alleviate various physical and mental symptoms, such as pain, anxiety, PTSD, nausea, vomiting, for use in palliative care at end-of-life transitions, sleep disorders, among many other uses. As a result, many people are turning to cannabis to help manage their chronic health conditions. The Canadian Cannabis Survey, conducted by Health Canada in 2019, found that 73% of people using cannabis for medical reasons are self-medicating without a prescription. This highlights a significant gap in healthcare providers' involvement in guiding patients' use of cannabis as a treatment option. It's also important to differentiate recreational and medicinal cannabis use. In most recreational use, people are seeking the psychoactive high from THC-dominant products. However, in medicinal use, people may focus mainly on the therapeutic benefits of CBD. Although the lines can blur between medical and recreational use, they're regulated differently, and medical authorization offers distinct benefits for patients who are seeking cannabis as part of their care. In discussing the medicinal benefits of cannabis, it's also important to acknowledge that there is a risk that cannabis use can become problematic. Cannabis use disorder, or CUD, is a condition that can develop with regular cannabis use over time. While cannabis use itself is not inherently problematic, regular use over a prolonged period can lead to mild physical dependence, and stopping can cause mild withdrawal symptoms. However, not everyone who uses cannabis regularly will experience these effects. CUD is a medical term used to describe a spectrum of cannabis use patterns, ranging from mild to severe. The condition is diagnosed when a person experiences at least 2 of the symptoms consistently over a 12-month period. These symptoms are listed on the slide and include things like using larger amounts of cannabis than intended, trying to unsuccessfully cut down, or continuing to use despite negative consequences at work, school, or in relationships. It's important to note that while these symptoms are used to define CUD, most people who use cannabis will not experience all or even any of them. Regular cannabis use or enjoying cannabis does not necessarily equate to problematic use. However, if any of these symptoms apply and cannabis use is negatively impacting a person's life, it may be time for them to reassess their relationship with cannabis and consider taking a break. This slide provides guidance and tips for supporting patients to mitigate the risks of cannabis use from a harm reduction lens. First, it's important to understand that cannabis use can lead to tolerance over time, meaning the body's cannabis receptors stop reacting as strongly to THC. This is reversible, and a tolerance break, where a person abstains from using any THC for at least 2 weeks, can help reset this sensitivity. For people who use cannabis more heavily, it may take up to a month, but even after a few days, the body's receptors will begin to reverse the tolerance. While THC tolerance builds up, CBD interacts with the body's receptors differently, making it unlikely for people to develop a tolerance to CBD. This provides an alternative option for some people who may not want to take a full break from cannabis. They could use CBD products for therapeutic benefit or to manage withdrawal symptoms without the risk of tolerance. If a patient's either unwilling or unable to take a full tolerance break, you can help them explore other strategies. For example, switching strains can provide a different cannabinoid profile that may help mitigate tolerance. Using more balanced products with higher CBD and little to no THC is another option. Additionally, microdosing involves consuming small amounts of cannabis throughout the day, allowing patients to gain the therapeutic effects of THC without building tolerance. Another option that may work for some people is varying their routines. Consuming cannabis at the same time every day can cause the body to expect stronger effects, leading to greater consumption. Waiting until later in the day or switching up the time of use could help manage this. Lastly, you could suggest using smaller amounts of cannabis, like smaller rolling papers or bowls, or even opting for edibles, which offer a longer lasting effect with less cannabis. When discussing cannabis use with youth, it's important to emphasize the heightened risks due to the brain's ongoing development until around age 25. Regular cannabis use during this critical period can have lasting effects on both physical and mental health. Physically, cannabis can affect brain function, leading to challenges with memory, concentration, and decision-making. There's also a risk of developing a physical dependency on cannabis, which can make it harder for youth to reduce or stop their use. Additionally, youth who use cannabis regularly are more likely to smoke cigarettes and experience respiratory issues similar to those caused by tobacco use. There are also mental health risks. Regular cannabis use in youth increases the likelihood of experiencing anxiety, depression, psychosis, and in some cases, schizophrenia. Beyond health risks, cannabis use may also affect a young person's overall life trajectory. Recreational use could lead to reduced academic performance, diminished participation in extracurricular activities, and a lack of interest in hobbies or peer groups they once enjoyed. These changes could compound feelings of isolation and strain in relationships with family and friends. To address these risks effectively, it's crucial to foster ongoing, open, and non-judgmental conversations about cannabis. These discussions should be grounded in evidence-based information, presenting both the risks and potential benefits of cannabis use. Presenting the positives of cannabis use is important because it helps inform youth that cannabis is not always bad, and that there's many circumstances where cannabis use can be helpful. This helps counteract stigma and encourages youth to engage in thoughtful, informed decision-making. Ask open-ended questions, use accessible language, and promote harm reduction strategies. For example, you can encourage reducing use, opting for lower THC products, and avoiding mixing cannabis with other substances. By creating a supportive and balanced dialogue, you can help share power with youth to navigate their relationship with cannabis in a way that prioritizes their health and autonomy. Let's shift our focus to broader considerations for supporting safe and informed cannabis use. In Canada, cannabis is legal for adults who meet the minimum age requirement, which ranges from 18 to 21 depending on the province or territory. In Alberta, the legal age is 18. In Quebec, it's 21. In all other provinces and territories, it's 19. It's important to stress that cannabis use alone should not be viewed as a cause for concern regarding parenting or grounds for child welfare involvement. Adults have the right to include cannabis in their personal health and wellness practices, and respecting their autonomy in this choice is key. Another important consideration is how cannabis can serve as an alternative to other substances, such as alcohol and opioids. By replacing alcohol with cannabis, individuals can reduce harms commonly associated with drinking, such as violence, injuries, and chronic diseases. Additionally, cannabis can also help manage withdrawal symptoms, making it a supportive option for those transitioning away from other substances. For instance, it's a legitimate and safer option for pain management, particularly for those who may otherwise rely on opioids. Long-term opioid use carries risks of significant health and social harms, including the potential for drug poisoning. In contrast, cannabis offers pain relief without severe side effects associated with opioids. While there are still risks with cannabis use and potential for dependency, it could be an option when abstinence from substances is not realistic. Considering the use of cannabis as an alternative to other substances is especially relevant for Indigenous people, as they are disproportionately impacted by the drug poisoning crisis. Systemic inequities and ongoing traumas have contributed to higher rates of substance use in Indigenous communities, and cannabis may provide a culturally safe, alternative harm reduction strategy to mitigate these risks in certain scenarios. Tailoring cannabis conversations involves a thoughtful, culturally respectful approach. Let's briefly review the foundational principles we've discussed. Ensure care environments are culturally safe and sensitive to past and ongoing trauma. Respect and affirm the intersecting identities of Indigenous women and gender-diverse people. Blend traditional Indigenous healing practices with Western health approaches to provide more holistic wellness. Consider how social determinants of health may impact the health and access to care. Emphasize practical harm reduction strategies that align with the patient's goal and minimize risks. Now, a key aspect of tailoring cannabis conversations is providing individualized advice. This involves understanding and addressing each patient's unique needs, experiences, and contexts. For beginners, this may mean starting with education on cannabis basics, such as the difference between THC and CBD, consumption methods, and potential effects. For someone who's a more regular user, guidance may focus on managing tolerance and refining usage to align with their long-term health and social goals. Some things to consider when supporting cannabis use in patients are helping patients understand strains or products that match their preferences, therapeutic needs, and underlying medical conditions. For example, patients managing anxiety may benefit from CBD-dominant products, while those addressing chronic pain might explore balanced THC-CBD options. Offer practical advice on forms of cannabis, like edibles, oils, or topicals, and methods of consumption that align with the patient's comfort level and goals. Discuss harm reduction methods around use and what effects they might expect, including things to monitor. And finally, ensure that recommendations resonate with the individual's personal and cultural contexts. We recognize that many healthcare providers remain hesitant to prescribe or recommend cannabis. However, this does create significant barriers to access for Indigenous patients and limits recognition of cannabis as a legitimate treatment option. While prescribing may not always be feasible, there are actionable ways to help reduce these barriers and support patients effectively. Start by recognizing and acknowledging the challenges patients face when navigating cannabis use as a potential treatment. It's crucial to engage in open, compassionate conversations with your patients, creating a safe space for them to discuss their concerns. As cannabis-related information evolves, it's important to remain up to date on the latest knowledge. Approaching these conversations with a harm reduction lens ensures that you're providing the most balanced, responsible care possible. An important factor to consider is that cannabis costs are not covered by the non-insured health benefits program, leaving First Nations and Inuit patients without financial support for their medical cannabis needs. Additionally, Métis patients don't qualify for the NIHB at all, presenting another layer of difficulty in their access to care. To assist, it's helpful to provide resources on cost-saving options, such as provincial assistance programs, patient support programs, or even information on growing and harvesting cannabis for personal use when appropriate. To further minimize barriers, take a multidisciplinary approach to care. This means collaborating with other health and social service providers like pharmacists, peer support workers, and cultural advisors to ensure patients receive the most comprehensive care possible. You can also share fact sheets and other accessible resources that are tailored to the specific needs of the patient, helping them navigate their cannabis treatment with the information they need. By taking a holistic, informed, and compassionate approach, you can help Indigenous patients overcome barriers and ensure they have access to cannabis as a legitimate and effective treatment option. Let's move into a practical application of these concepts. In this section, we'll explore a case study featuring an example of how a healthcare provider might respond to a patient accessing cannabis. This will highlight both the challenges and opportunities for improving patient care through culturally safe and trauma-informed approaches. Before we get started, we want to acknowledge that this case study is fictional. However, it was developed by the Advisory Circle based on personal insights and real lived experiences of seeking medical advice for cannabis use. Dakota, they/them, a 35-year-old two-spirit parent of 2 children, has been managing chronic pain due to fibromyalgia for several years. They have been prescribed opioids, but are concerned about the long-term use of these medications, specifically the risk of addiction and the side effects of fatigue and mood changes. Dakota is seeking to explore medical cannabis as a potential alternative to manage their pain more safely. They've heard positive things about cannabis from their community, but are also unsure about how this might affect their role as a parent or exacerbate their anxiety. In this first example, Dakota, seeking guidance on medical cannabis as a safer alternative to opioids, faces a dismissive response from their provider. The provider firmly rejects the idea, stating, "I do not prescribe cannabis. Also, there's no solid evidence to back its use for pain management. I recommend you stick with your prescription." They do not address Dakota's legitimate concerns regarding opioid use, address how cannabis might affect their role as a parent, or present the possibility of using cannabis within a harm reduction framework. Further, this situation has not been approached through a trauma-informed lens. Dakota's Indigenous identity, role as a two-spirit parent, and the unique ways their pain and concerns impact their family responsibilities have not been considered. The provider's refusal to engage in a compassionate, collaborative conversation not only invalidates Dakota's concerns, but also leaves them feeling misunderstood and stigmatized. The attitude of this provider is an example of how systemic anti-Indigenous racism and biases in healthcare can manifest and impact a patient's experience. As a result, Dakota leaves the appointment with their concerns unresolved. The lack of compassionate engagement leads to a sense of alienation and is compounded by previous negative experiences that they've had within healthcare settings. They now feel like they can't discuss cannabis with any health professionals, so they don't seek out alternative options. With no support or clear information, Dakota turns to self-medication and experiments with cannabis, using unreliable sources of information. Without professional guidance on safe cannabis use, they risk dangerous interactions with opioids. Trying incompatible dosages and strains, they start to experience mental health side effects, which further complicate their ability to manage their chronic pain and parent effectively. This is not how this situation should have been approached. Now, let's look at how this interaction could have been handled differently. In this example, the provider begins by acknowledging the growing evidence supporting cannabis for chronic pain management and validates Dakota's interest in exploring it as an option. The provider affirms their concerns about opioids and frames the conversation with openness and understanding. Let's explore your options and see if cannabis might be a part of your treatment plan. The provider recognizes the unique concerns Dakota has as an Indigenous parent. Drawing on their trauma-informed perspective, they reflect on how these concerns could be related to the trauma associated with child welfare and substance use policies impacting Indigenous people. They reassure Dakota that cannabis, when used responsibly under medical supervision, will not jeopardize their parenting role, addressing Dakota's anxieties and fostering trust. The provider emphasizes the importance of physician oversight, particularly when combining treatments like cannabis and opioids. They reassure Dakota that this process will be carefully monitored to ensure safety and effectiveness. Although the provider doesn't prescribe cannabis themselves, they offer a thoughtful referral to a cannabis specialist and take the time to educate Dakota. They explain the differences between THC and CBD, particularly how these compounds may affect anxiety, while preparing Dakota for a trial and error process. Additionally, they acknowledge that Indigenous knowledge and cultural practices may offer complementary or alternative ways to manage their pain. They provide resources like fact sheets and make recommendations for Dakota to access Indigenous-led health and community services, an elder, and/or two-spirit support networks that could help them in their journey. Through offering these, they've reinforced that Dakota's concerns are being taken seriously and that their mental health is being supported. As a result, Dakota leaves the appointment feeling heard, encouraged, and more knowledgeable about how to navigate these next steps. They feel reassured because their concerns were validated, and they're now more confident in exploring cannabis as a treatment option with ongoing oversight from trusted healthcare providers. Dakota feels in control of their journey to manage their pain more safely, knowing that their role as a parent and their mental health concerns are being taken seriously. In presenting the two examples from Dakota's experience, we see a clear contrast between dismissive care and a supportive, informed approach. Here are the key lessons we can take away. Providers' approaches shape patient outcomes. The way a provider responds to a patient's concerns can significantly influence their experience. Like in the first example, a dismissive approach can lead to mistrust, self-medication, and potential harm. In contrast, supportive and empathetic care builds trust and shares power with patients to make safe and informed decisions. Trauma-informed care is essential. Dakota's case highlights the importance of understanding and respecting the historical and cultural context of Indigenous patients. Providers must be aware of how systemic issues, such as child welfare policies, create unique concerns, especially around parenting and substance use. Acknowledging these realities reduces barriers and affirms the patient's experiences. Comprehensive communication builds trust. Patients need clear, accessible information about their options. In the second example, the provider took the time to validate Dakota's concerns, educate them on cannabis, and discuss potential risks and benefits. This type of open communication fosters trust and equips patients to make decisions confidently. Collaboration enhances patient outcomes. Effective care is a team effort. Referring Dakota to a cannabis specialist while continuing to support them shows how a multidisciplinary approach can enhance a patient's outcomes. Providers should also connect patients with community resources for additional supports. Responsibility as a provider. Even if a provider doesn't prescribe cannabis, it's their responsibility to guide patients through their options. Staying informed about current research and providing access to culturally relevant resources are critical for patient safety and sharing power. Overall, these takeaways demonstrate the power of a compassionate, informed, and collaborative approach. Each patient interaction is an opportunity to build trust, reduce harms, and support patients in making the decisions that reflect their unique needs and goals. This next section highlights Indigenous-specific resources that promote culturally relevant cannabis education and harm reduction practices. Many of these initiatives are designed by and for Indigenous communities, integrating traditional knowledge, lived experiences, and trauma-informed approaches. The first Indigenous-led initiative we'd like to highlight is NWAC's Cannabis Education website. This website is part of a larger project titled A Community-Informed Approach to Cannabis Public Health Education and Awareness. Through this project, NWAC engaged urban, rural, and remote Indigenous communities and identified the current awareness and priorities of Indigenous women and gender-diverse people around cannabis public health education. This website offers a wealth of tools and information. Cannabis in Canada explains how to read labels, understand consumption methods, assess potency, and navigate cannabis laws across provinces and territories. Cannabis Basics covers the anatomy of cannabis, differences between compounds like THC, CBD, and terpenes, growing and harvesting practices, and debunks myths. History and Traditional Stories includes an elders section with personal accounts and a historical timeline of cannabis in Canada. The cannabinoid dose calculator helps people, whether new or experienced, determine the best dosages for their needs. Paired with the cannabis dosing and symptom log, this tool supports personalized and informed cannabis use. Cannabis and Health features detailed sections on parenting, youth, pregnancy, lactation, seniors, and the use of cannabis with other substances. Cannabis and medical use guides people through the prescription process, helping them decide if medical cannabis is right for them and what to expect. Cannabis use disorder explores diagnostic criteria, tolerance management, and cannabinoid hyperemesis syndrome, offering strategies like reducing dosing or tolerance breaks. And finally, the resource section provides downloadable fact sheets in English, French, and Inuktitut, and access to NWAC's published reports on cannabis education, cannabis and mental health, and cannabis use during the perinatal and postpartum period. There are also many resources provided by the First Nations Health Authority. The Care Through Connection Cannabis Use Across a Lifespan document is designed to support healthcare providers in facilitating open, compassionate conversations about cannabis use. It emphasizes a harm reduction approach that's person-centered, trauma-informed, and culturally safe, ensuring that providers are well equipped to offer care to First Nations people. In addition, their website offers a range of valuable tools and information, including mobile apps for managing mental health, cannabis resources for both healthcare providers and the community, educational materials on cannabis, maternal health, safer cannabis use, and support for youth. The State of Métis Knowledge on Cannabis and Mental Health in Canada is a key resource developed by the Métis Nation Council. This document provides a high-level overview of cannabis use in Canada and its relationship with mental health, specifically to inform future research areas for Métis communities. The report identifies significant gaps in the existing literature regarding cannabis use and mental health outcomes for Métis people, a critical limitation requiring further attention. This is a valuable tool for fostering discussions around creating more inclusive and Métis-focused research and resources. Let's talk about UJREC is a cannabis harm reduction toolkit created by the Paututik Inuit Women of Canada. This toolkit is guided by Inuit values and is designed to increase knowledge around cannabis use and how to reduce potential harms, all while taking a trauma-informed and strength-based approach. These materials are tailored to support new and expecting parents, youth, and the broader Inuit community in making informed decisions about cannabis use. Service providers can also benefit from these resources. For example, the discussion guides for starting conversations around cannabis use provide practical strategies for initiating supportive dialogues. The Reflecting on My Cannabis Use tool is a short, anonymous activity designed to help individuals reflect on their cannabis use, assess its impacts, and explore relevant resources based on their decisions. Additionally, the toolkit features beautifully designed posters and fact sheets available in English and several Inuit languages. These materials are perfect for display in workplaces or community settings to increase awareness and spark conversations. There are a few research resources that would be valuable for understanding various topics surrounding cannabis and health. NWAC's research paper titled Conversations on Cannabis and Mental Health was published in 2023 in the International Journal of Indigenous Health. This explores the needs and experiences of Indigenous people regarding cannabis use and mental health, with 4 key recommendations being outlined. There's also the Canadian Centre of Substance Use and Addictions report, titled Clearing the Smoke on Cannabis. This was published in 2024 and presents up-to-date research findings for cannabis use for a variety of health issues, such as pain, cancer, fibromyalgia, neurological disorders, and substance use disorders. Another useful resource is Health Canada's Information for Healthcare Professionals website, and although this was published in 2018 and is not currently up to date, it does provide an extensive background summary of cannabis health research and details recommendations and advice surrounding topics like clinical pharmacology, dosing, potential therapeutic uses, precautions, and adverse effects. This slide also provides a few additional resources that can support further learning and practices related to Indigenous cannabis use. These resources include toolkits, policy documents, and research findings that highlight different perspectives, challenges, and approaches to cannabis use within Indigenous communities. To conclude, we wanted to highlight NWAC's Anti-Indigenous Racism Toolkit for health and social care providers. This resource is designed to support health and social care professionals in addressing and reducing racism in their daily practices. The toolkit acknowledges the challenges Indigenous people, especially women, girls, two-spirit, transgender, and gender-diverse individuals, face when accessing services. Many have experienced systemic racism or medical trauma, making these interactions intimidating or re-traumatizing. Practical strategies include tools like post-visit surveys to collect feedback in a safe way and guidance on understanding the needs of Indigenous patients. We encourage you to explore this toolkit and consider how its principles can enhance your practice. That brings us to the end of this presentation. Thank you for taking the time to engage with this important topic.